This conference will now be recorded.
We have them speakers. Hello?
This is Dr. Kohler. Ursula, are you on the line?
This is
So Ursula was going to be on the line to introduce us, but I'll go ahead and start things off. And this is Dr. Robert Kohler. I'm the medical director here at PACE of the Triad. And we have this session scheduled today to answer your questions. We have doctors on the line. We have Dr. Ensminger and Dr. Williams and myself. And we want to talk about and answer any questions you might have about COVID, but also especially about the COVID vaccine and our plans for that and how we can get the vaccine to our participants and get them immunized against this terrible virus going on. So at this point, if you've been watching the news, COVID is really going out of control right now. It's really spreading very fast. The hospitals are very busy. They are no longer able to take care of routine elective procedures and have to really devote all their efforts towards taking care of COVID patients and other sick people that absolutely need to be in the hospital. This is also an interesting time because this is when the vaccine has become available. It became available a little bit more than a month ago, and the rollout is a little bit slower than we had wanted. The people in the hospital actually taking care of the very sick people in the hospital, the very sick COVID patients, they have gotten immunized first, and that was very important. And they have gone through that process, and now it's hoped that we can start spreading the vaccine out to other high-risk groups, which would include you and me. It would include the staff here at PACE of the Triad, but also, even more important, all of our participants with PACE of the Triad. We are working right now trying to get that vaccine. We're working on it through many different sources. We're trying to get it through our own pharmacy.
Am I on now?
Yeah, Ursula, I was doing the introduction, if that's okay.
Oh, that's wonderful. Please keep going, because I was steady on the other line doing the introduction. Go right ahead, Dr. Cass.
Okay. And so, so we've been working on getting the vaccine. We're working on it to try to find it from different sources, from the hospital, from Wellspring, who's our partner with us, with the health department, with our own pharmacy. But we're working on it, and we will get it, but we're not sure exactly when that will be, but we're hoping to get it as soon as possible. So my mission at this point is to hear your questions. We know you have questions. We know that there's some uncertainty. This is a new vaccine. This is a new disease. What's going on? Why aren't we getting it yet? What are possible side effects? That sort of thing. And we want to be able to answer questions. So any questions or comments or anything at all, we're strongly encouraging it. We want to have a good discussion here today. So Ursula, do you want to add anything else to as an introduction? I think we're almost ready for questions.
Okay. Did you introduce the staff members that we have from PACE?
I introduced the three doctors, Dr. Williams, Dr. Ensminger, and myself, Dr. Kohler. Ursula Robinson is our program director. And we also have Lucia Mero, who is our center manager, and Nidra Baldwin is our marketing and outreach manager. We also have Adria Smith. She's handling the technology side of this.
Great, thank you. And did you mention about not using your name when you're speaking, Dr. K?
I did not mention that, but thank you for reminding me. We want to be able to answer all questions, so you can just go ahead and ask the questions, but there's no need to introduce yourself. We want to maintain patient confidentiality, so you can just blurt out the question and that would be fine. Anything else, Ursula, did I miss?
I think you got it. Thank you.
All right, thank you. So who wants the first question?
I'd like to know if COVID-19 vaccine, will it have any kind of side effects with medication taken morning, noon, and evening?
Very good question. So The question that I understood was that does the vaccine interact with any of the medicines you might take, even if you're taking a medicine maybe 3 times a day? So I'm going to let Dr. Williams actually answer that question. So Dr. Williams, respond to that.
Yes, wonderful question, and these are exactly the types of things we want to talk about. This is a new vaccine, it's a new disease, and we're just trying to all figure it out. But the quick answer is that you don't have to worry about it interacting with any of your other medicines, no matter what you take and no matter what time of day you take them. The vaccine won't have any interactions with those medicines and are completely safe for people who take medicines and for people who don't take medicines. So I'm really glad you answered that question. Does that answer it for you sufficiently?
Yes, very much so. Thank you.
Good. Thank you for your question.
Okay, who else has got one?
Is the vaccine the Moderna or the Pfizer?
So I'm sorry, I didn't hear the whole question. It was about the Moderna vaccine. And what were you asking?
Is it Moderna or Pfizer?
Okay. So there are 2 vaccines available in the United States right now. One is from Moderna. You're right, that's the company that produces that one. And the other one's from Pfizer. And they're both being distributed out throughout the community right now. So we're not exactly sure, which vaccine any one of us is going to receive, but both seem to be equally effective, 95% effective. From a practical point of view, if we have the vaccine, it's probably going to be the Moderna one because the Pfizer one requires some extra storage and handling, which is really beyond our capability. You need to have a freezer that can go to like minus 94 degrees, and that's really not readily available. But I think the health department and the hospital, they're giving out both, and I would feel comfortable with either one of those. They're very similar. Just the Moderna one is a little bit easier to handle than the Pfizer one, but they're both equally as effective. But that's a good question. Thank you.
Thank you.
Did that answer your question there?
Yes, thank you.
Good. You guys are doing great. What else we got? Next.
I have someone who. Hello, I have someone. Oh, good.
Yes,
I was going to say I have someone who has already. He's in a facility and he's already had the first dose of that first vaccine. My question is, are they going to be able to give them that second one? Because there's so much, stuff going on in the news about how, right now they're saying that everybody's going to get it from 65 on up or whatever. So they're not holding anything back. Will they still be able to get that second dose when they need it?
Yeah, great question. That's in flux. And I'm going to hand that one off to Dr. Ensminger because that's a great question. I wondered about that too. Dr. Ensminger.
I believe Dr. Ensminger is not able to join us at this very moment. She'll catch on later, but I'll take that question. From what we understand, this is kind of interesting. The federal government has partnered with local pharmacies, such as Walgreens and CVS, to provide all of the shots for our long-term care facilities. And they actually developed an agency to make sure that enough vaccine is provided to all of them for 2 shots. So the way we've been informed is that each of the facility orders enough for 2 shots right off the bat. So those are reserved for those individuals. So we anticipate that at least for those long-term care facilities, they're in the best standing that they could be to be able to get their second shot. Now, the rest of us, we're not so sure about that. And just like you, we're watching the news and reading updates every day to try to figure out how the supply and distribution will be going. But for now, we're feeling pretty positive about our long-term care folks. And I am so excited that many of them have already gotten their first shot. Great question.
This is Dr. Kohler. I want to add that my mother, she's in a facility in Charlotte, and she got her first shot a week ago. Yeah, I agree. It's a great opportunity. From a scientific point of view, it doesn't, the Pfizer vaccine was tested with the second shot after 3 weeks, and the Moderna shot was tested with the vaccine after 4 weeks. But in theory, the biology of it all, it really shouldn't make a big difference if you wait, an extra week or 2 or 3, because it just basically boosts up the original vaccine shot. So, we just know that it was tested every 3 weeks or every 4 weeks, but in theory, it really shouldn't make a difference. So it doesn't seem to be any harm. It doesn't seem like, oh my gosh, if I don't get that second shot exactly in 3 weeks, it's going to be wasted. It won't work that way. It should be just fine, even if you get it a week or 2 later. We're hoping it'll be right on time, but yeah, there are questions out there. Thank you. Good question. You guys are doing great. Give me another question. What do you got?
Okay, I have a question. I got on a little late, but I've heard some of the other questions. But I want to know I don't know how long it's going to be before you guys get the vaccine, but if there is a person that's with your facility is able to get the vaccine somewhere else, and I think this was answered some in this question, will they be able to possibly pick up the second dose with you because of the timeline that you guys are doing getting the first dose? I don't know if it's going to be a week, 2 weeks, end of the month before you guys issue the first dose, and there are doses out that we can call and actually get on a waiting list or get to a facility that is actually issuing the vaccine. So would you all be able to administer the second dose to your clientele if they get the first dose somewhere else?
Yeah, that's a great question because it's something that we've actually asked about ourselves. And we're trying to get the vaccine from multiple sources, and whoever can provide it to us first, that would be great. But in the meanwhile, it is being offered now in the community. It's hard to get an appointment, but if you are able to get an appointment, it is fine with PACE for any of our participants to get it anywhere they can. But you might wonder, well, gosh, if I had one vaccine at the health department, what do I do about the second shot? There is actually going to be a registry where we can check to see which vaccine you had, when you're due for the second one, and it could actually be done at different locations, but there's a registry that will hopefully tie in that together. Dr. Williams, do you have any more details about that?
No, theoretically, you can get the second shot anywhere it's available, as long as it's the same vaccine. So Moderna has to be repeated with Moderna.
Yeah.
And Pfizer repeated with Pfizer. The question will be just logistics, and right now our timing is an uncertainty. But we are thinking that as long as we can make it efficient for people to get their second doses, we can participate in making sure that happens. But again, we have no promises because we're sorting this out as we go ourselves.
Okay, you asked part of my question as well, because I was going to say if she got the Moderna somewhere else, would she be able to get the second dose of Moderna from you, or vice versa? If she got the first dose of the other one, would she be able to Pfizer? Would she be able to come back and get the second dose of Pfizer with you? So that was why I was asking. So okay, so you answered that when you said that it would be the same vaccine. So if we got one somewhere else, then we'll be able to come back and get the second part of that particular dose with you at PACE.
Maybe. And again, it depends on our supply and when it happens and the timing. Ideally, when you go to get a vaccine anywhere, they're going to want to say, we want you to come back in 3 weeks if it's Pfizer, or 4 weeks if it's the Moderna. And they're going to say, can you come back on this date and time? They're going to want to try to get you in for an appointment. Similar for us at PACE. If we give the first shot, we're going to try to get the schedule done right away for the second one to be administered. So for the first people who are at risk, so the healthcare providers, the hospitals, the long-term care folks, the folks over 75, and the folks with chronic conditions, I anticipate that there's going to be enough vaccine for them to get their second shot. I think it may be for the rest of the population where that second shot could be delayed a little bit. And I say that only because of the news that's come out yesterday and today about some changes in the way it's going to be distributed nationwide.
Mm-hmm. Okay. So, but you guys really don't know around what the time frame that PACE will actually receive the vaccine.
No, we don't. I wish we had some definitive answers, but our pharmacy is themselves waiting to receive their batch so that they can distribute it.
Yeah, it seems that a lot of pharmacies want it also, and right now the highest priority is for the state to get it, and then the state distributes it out to hospitals and to health departments, and then CVS and Walgreens are also a big part of this. And CVS and Walgreens have been more devoted towards the nursing homes and assisted living facilities. But once those people get fully supplied, then it'll start going out to the other pharmacies and other primary care sites. And we're all a little bit frustrated. The rollout hasn't been as quick as we want, but I have full confidence it will ramp up and we'll have full production and full distribution within a few weeks. It's just a few weeks later than I had wanted, but it'll still happen.
My question is.
Go ahead.
My question is, what about allergies to it?
Okay, yeah, that's good. If you have a severe allergy to any part of the virus, or excuse me, any part of the vaccine, you shouldn't get it. But that would be quite unusual. The recommendation right now is if you just have, routine run-of-the-mill allergies, allergies to pollen or whatever, it's not an issue. It's not a problem. It's only that very rare person who's had a terribly severe allergic reaction in the past to, say, peanuts or a bee sting or something like that, where they needed to get an emergency shot of epinephrine or adrenaline to reverse the effects. Those people probably should not be getting the shot right now. But even people who have never had a severe allergy, we're being safe and watching people for 15 minutes after the shot to make sure that there's no, rare reaction to that person. And we're also very prepared. All these sites are very prepared to handle an emergency like that if it should happen. The odds of it happening, though, those really rare reactions that you see about on television, they're rare. There may be 1 out of 100,000 shots. So they're not that common, but we're prepared for that. And we're avoiding giving those shots to people who have a known very severe history of a reaction in the past. Dr. Williams, do you want to add anything to that?
I'll just reiterate, those are all good points, Dr. Kohler, and this is a very good question and probably one of the most common concerns that people have because reactions are highly publicized in the media, so we hear about them a lot, even though they are not common at all. Having said that, the chance of an allergic reaction to a medicine happens with all of our drugs and pharmaceuticals and shots for some people. We even have people in the community who are allergic to aspirin or allergic to Tylenol, for example. Having an allergy doesn't mean that you can't have the shot. It just means that when we hear that history, let's say when you go in and you're giving the vaccinator your medical history, they'll say, okay, well, just stick around with us for 30 minutes. We have all the equipment and the medicines we need to have to give to you if you should show a response. So when a person has an allergic reaction that's severe, it's scary, but it's also very treatable. And every vaccine clinic, any place that you could get the vaccine in a clinic is going to have those medicines available in case a person would have a reaction.
Thank you.
You're welcome.
Good. Another question.
Are y'all do the patient have to come to y'all, or y'all coming to the houses, or how's that going to roll out?
Right. And at first we were thinking about going to the home also, but because of the issue that Dr. Williams just talked about, we will not be doing vaccines in the home because we want to have that capability to handle any rare emergency, and so that we have that capability here at the PACE clinic, or you would have it at the pharmacy or at one of these health department clinics. But in the home, that would not be completely safe there. So we've elected to not do it in the home this time. We've done flu shots in the home, which is fine. But for this vaccine, we're going to want to do it at the facility, either here at PACE or at the health department or at a pharmacy. Thank you for that. That's a good question. What other questions we got?
If you have two people in the same household and one is the over 75 and then the other one is, 65, are they able to get their shots at the same time at pace? Especially since they're living, closely together in the same house.
Right, and you've heard that that the state wants to try to get the shots into people 75 and older. If and when we do get our vaccine, we're going to give it out to everybody. And
okay.
What's going on? So yes, so we would give it out to all of our PACE participants, no matter what their age is. But the health department, I think that if the 75-year-old would have to go in first, and then the 65-year-old would have to wait a couple weeks. Dr. Williams, do you know anything different about that?
No, I don't have anything different. I just don't. I don't know. I don't think they're going to want to turn people away in a clinic. Let's say if one's over 75 and one's not. And it sounds like the urgency of getting more people vaccinated sooner is so high that I'm thinking they're going to be rolling it out to all sorts of people in the next week or two.
Okay.
Good question. Some people have asked the question in the past about if, suppose somebody's already had COVID, do they still need the vaccine? And I'll pass it back to Dr. Williams on that one. She's very good at answering questions.
And we've got Dr. E who's on the line as well. Yes, the question is, if a person has already been diagnosed with COVID, with or without symptoms, do they really need to get the vaccine? And the reason we ask that question and wonder is because there's information that some immunity comes from having COVID, so wouldn't that be enough? And the answer is yes. If you have had COVID with symptoms or without, you still should get the vaccine. And the reason is that we don't know how much immunity each individual's COVID illness gives them. And we think that it may differ based on how sick they were. So it's quite possible, let's say, that a person who got COVID and didn't get very sick may not have much immunity because there wasn't a whole lot of virus that settled into the person to cause an immune response. What the vaccine will do is give us a measurable, reproduced, consistent response. There's no harm in getting the vaccine after you have the illness. The only thing that we request is that you wait about 10 days or so after you've recovered before you get your vaccine. And whether or not you've had COVID will be one of the questions that are used in your screening questionnaire when you show up for your shot, because they are keeping data of all of these sorts of things. Good question.
Good, thank you. Thank you. Good. We need another question out there. Who's got one?
Yeah, I got one. I'm trying to see if it's going to be like a seasonal shot for COVID, like the flu shot, or is this a one-time shot?
Yeah, great question again. Actually, Dr. Ensminger is here on the line, and I'm going to let her answer that question. Thank you. Dr. E, can you answer that?
Yeah. So with what we know now, we know that right now you require 2 shots. So the first shot, and then 3 to 4 weeks later, a second dose. There is still research being conducted to determine if just those 2 doses will be enough to provide immunity long term. So we don't quite know just yet. I think some preliminary studies have shown that it does last at least a year, and we may need a third booster shot, but we're not quite sure yet.
Good, thank you. And yeah, time will tell, but that's a very common question. We all wonder about that. In theory, this type, the flu virus changes so rapidly year after year And that's the big reason why you need a flu shot every year. This coronavirus, the COVID virus, does not change as much as the flu virus, so it's quite possible that these two shots will provide long-term protection. So that's what we're hoping, but time will tell. What other questions we got?
I have a question in reference to they're saying that there are new strains that are out there, the Moderna and the Pfizer. Do you feel confident enough that that's going to take care of any of the new strains that are coming out?
Yeah, so we've heard that question a lot, and I'm going to hand that off to Dr. Williams. She's got a good answer for that.
If I understand the question correctly, we're concerned that we've heard that there's different strains of the coronavirus, and we're wondering if the two vaccines that are approved right now, which are the Moderna and the Pfizer, are going to be able to handle those new strains. And is that correct? Did I get the question correct?
Yes, that is correct. Yes.
Okay. So the quick answer is yes, we feel pretty confident that those strains are going to be covered. And that is based on what it means when we have a new strain and what that strain is doing differently in the virus than the original one. So I'm going to try to make this an interesting but short answer. Viruses are always changing. Bacteria are always changing. This is just what they do. And coronavirus is going to be no different. The virus that changes the most in our world is flu. It's so different every year that, just like Dr. Kohler said, we have to have a new vaccine every year because it's so vastly different every year. So corona is going through the population. The more people or animals or whatever hosts you have for it to spread through, the more likely it is to change. So the virus specialists, they're called virologists, are studying these viruses on a continuing basis. They're looking at them all over the world. They're looking at them in different parts of the country to see how the virus is changing. And they've been able to tell that the virus has changes in its genetic makeup. What's different this time is that it looks like at least one, if not two, variations of the virus. One first identified in Europe and one identified in the US, maybe a second one. They notice that they seem to be spreading faster. So they've been tracking this, and they can tell that the viruses are more contagious. They're more easily spread from person to person for some reason. But the good news is that they don't make us sicker. And thank goodness for that, because we're already suffering from numbers that are just going out the ceiling. All right, so why do we think the vaccine will help it, just like it does with the original? Help get rid of it, I should say. It's because the parts of the virus that have changed are not the parts that are targeted by the vaccine. There's a certain protein called a spike protein, those little knobby things that look like they're coming out of the virus that you see in all the pictures. Those are called spike proteins. Mm-hmm. One of those spike proteins is what the vaccines are set up to fight against, and then the changes in the virus have not affected those. So we expect for the Moderna and the Pfizer to be able to give us immunity to both of the strains that have come out as being more contagious. Now, having said that, I hope that helps. But having said that, I have to say a caveat that all of us are learning. The scientists are studying this and giving us updates every day, every week. So it's a changing platform, and we just have to kind of keep our ears open for the experts' updates. Thanks for the question.
Okay, thank you.
We need another question. Go ahead.
I have a question.
So what should we be listening to know whether or not you have the vaccine? Is it coming through email or text?
Actually, we'll have our social workers and our home care coordinators, part of our IDT team. Right now we're checking with everybody. If you haven't heard yet from your team members, call in. But we want to get a master list about who is going to be interested in getting the vaccine. And, once we get it, we're going to let people know as soon as possible. Lucilia or anybody else on the team want to address that? Oh, maybe not, but we'll definitely we're trying to keep a record of that. So if you feel, any of you on the line feel like they haven't heard from PACE about asking if you were interested in the vaccine or not, we want to know. And so please call your social worker or your home care coordinator or any member of your IDT team and let them know that, hey, I'm interested in getting the vaccine as soon as possible. Or you might say, I'm interested in getting the vaccine, but I want to wait a month. Whatever it might be, we want to know your preference, and then we're going to keep a master list and contact you as soon as we get it. If for some reason you can find it on your own, through the health department or whatever, that is fine as well. We just want to make sure we know who's getting the vaccine, where they're getting it, and keeping records of that too. So thank you. Other questions? Or did that answer that question?
Yes, it did.
Thank you. You guys are doing great. What else? I need another question. A common question that we have heard is, or concern, is that, my gosh, this vaccine these vaccines were made so quickly. It's only been a year since the virus came out. How do we know that they're safe, because they came out so quickly? I'm going to hand that off to Dr. Ensminger and let her give a stab at that one.
So in regard to how fast the vaccine was developed, the technology that is used is called messenger RNA, and that technology has actually been around for quite some time. Given that this coronavirus is a global pandemic, we had significant funding backed by Operation Warp Speed, which is an organization that is through the federal government with collaboration with other organizations to create the vaccine, to provide research, to provide funding. So as far as the technology is not new, but because of so much support and many stakeholders participating in creating the vaccine, it was created within the time frame that it was.
Okay, good. And we have time for one more question. Who's got a good question? Or any question? Well, this is Dr. Kohler. I'm going to, does anybody have a question? So I guess we can go ahead and wrap up. We've had a great discussion here today. I just want to make sure everybody knows that all the doctors here, we highly recommend the vaccine. We want to get all of our participants vaccinated. We want to get everybody vaccinated. One of the things that I'm personally hoping for is if we can get 50, 70% of Americans vaccinated, we can get rid of this virus. The virus will have no one to attack anymore if everybody's immune. That's what we call herd immunity. And we can get back to normal. It may take a year or so, but I want to get back to normal, and I think everybody else does too. And the more we can all do it, get the vaccine, the more we can get immune to it, then we can starve the virus, and the virus has no one to infect anymore, and we can get rid of it. And I think it's very safe. I'm going to be getting it on Monday, and my mother got it, and we have had several of our participants have already received it at the facilities, at the nursing homes, and they've done just fine. So I hope you all will get it, caregivers and participants alike. And I guess we'll wrap that up. Is that okay, Ms. Ursula? I think she's off the line, but Nidra, do you want to wrap up at all? Nidra's on mute, I think. Okay. Well, I'll be the one wrapping it up then. Okay. So thank you. You've been great, and we're going to be doing this again on Thursday, I think at 1:00, if I remember right. And we look forward to hearing more questions if you may have them. Okay. Thank you. Bye-bye.
Bye.
Thank
Bye.
you.
Bye.